All right, Dr. Sharma, let's start off with just sharing what is Digestive Care Center?
So, Digestive Care Center is a center where we treat problems of the digestive tract, stomach, esophagus, colon, small bowel, liver, bile ducts, pancreas.
And what kind of symptoms would prompt a person to call Digestive Care Center?
If somebody's having difficulty swallowing, or if they're throwing up blood, they're having blood in the stools, or they're having jaundice where they're turning yellow, the skin is itchy, or they're having constant and severe diarrhea where they're losing weight, then they should promptly call our office or call the primary doctor.
Now, does this require that you get a referral from your own physician?
Not always. Some insurance companies may require that you get a referral, but we do see self-pay patients, and we do have a lot of patients who self-refer.
All right, and let's talk about. I think one of the really key points for a lot of people is getting colonoscopies, because that's always one of those things that everybody puts off.
Right.
When should a person schedule a colonoscopy with you?
Well, this mostly depends on your risk factors. If you're an average risk person, which means nobody in the family has colon cancer or no other cancer of the gastrointestinal tract, or other cancers of any other organs like uterus, brain, etc. If you're average risk, then 50 years, 50. But if you have more risk factors in your family where your first-degree relatives or two second-degree relatives were diagnosed with colon cancer or other gastrointestinal tract cancers or pancreas cancers, then you may need a colonoscopy earlier.
All right. And once I've had that first colonoscopy, how long should I wait before I go in for a second one then?
This will again depend what we find during the colonoscopy which we perform for the first time. If your average risk and this colonoscopy is a negative or has polyps which are not pre-malignant, then your next colonoscopy typically is 10 years. But if we find polyps, and depending on the type of the polyps and the number of polyps, and also the quality of your colon prep, which means how clean your colon is during the procedure, then we decide upon an interval for you. And this is very subjective, and we tailor this to individual patients.
All right. Now, how many doctors are working with you?
At this time, we have 12 doctors in our practice. This also includes a surgeon, and we also have one pediatric GI doctor.
Excellent. Dr. Sharma, thank you very much.
Thank you, Mike.